sort of set of questions I want to ask is about coronavirus vaccine boosters. Once the majority of Americans are vaccinated, what are we looking at next? Are people going to have to get booster vaccines every 6 months?
You know, we don't know the answer to that for the simple reason that we don't know what the durability of the protection against the standard virus is. We know the most recent reports were that said at least 6 months, but it might be much longer than that. It could be years for all we know. So we're going to continue to follow it every several months to see when the level of these important antibodies begin to diminish in their level in the body. And then we'll know whether or not we need to boost. The other wild card in this is the variants. If the variants prop up and the protection against the variants by the vaccine-induced antibodies that we've used diminishes somewhat, we may need to boost people. So it's entirely conceivable that we may need to boost individuals, but we don't know what the intervals of those boostings will be right now.
Okay. And a lot of the frontline healthcare workers, they're approaching their 6-month mark. And Pfizer recently put out a report saying that at 6 months, they're still at above 90% efficacy.
Right.
At what point, do you expect vaccinated people's protections begin to wane?
You know, we don't know the answer to that. If you look at the curves that they published, the level of the antibody goes up after vaccination, then it goes down, and it continues to come down very, very slowly. We don't know where it's going to end to the point where it gets below the critical level of protection. We have what's called correlates of immunity that we will figure out. In other words, what the correlate of a level below which the protection is going to diminish. Certainly, looking at the curves now, the people who've been vaccinated are way above that level. So they have a way to go yet. But if you follow over a period of months till you get to a critical cutoff point, then you'll say, we're probably going to have to revaccinate or boost people.
I see. I read a report from the CDC that, the current seasonal flu vaccine has about ranging from 40 to 60% efficacy, and that prevents millions of hospitalizations for flu. Could you maybe explain to people that don't really understand how efficacy works, at what percentage do people start to need to be maybe concerned that they need to start thinking about, I should probably get a booster?
Well, I think you're going to get into some confusion when you compare influenza vaccines because, right away, the overall efficacy of the coronavirus vaccines is substantially greater than even the best of the influenza. So you got to be careful. Influenza, you change the vaccine usually every year because the virus is known to drift a bit in the sense of changing. We're not sure once we get the level of virus so low in coronavirus, whether or not the virus will have a chance to drift because it has to replicate in order for it to drift. Now, if we suppress it in the United States or in the developed world, that's going to be great. This brings up a real important question. As long as you have virus replicating anywhere in the world, the chances of developing variants are considerable, which will ultimately come back and could perhaps negatively impact our own response. That's one of the real prevailing arguments for why we need to make sure the whole world gets vaccinated, not just the people in the developed world.
Yeah, of course. And just to get a little bit on those variants, Dr. Michael Osterholm of the Center of Infectious Disease Research and Policy said that the current B117 variant is he called it a brand new ball game, a game changer due to its mutations and its apparent ability to rapidly infect a younger segment of the population, as well as its possibility to evade antibodies. Do you agree with that assessment?
Well, I listened to what Michael, who's a good friend, said, and he's concerned about the rapidity with which this spreads from person to person. But what he does also admit is that the vaccines are very good against this variant. So that's what I keep saying. It's a race against a variant that's spreading rapidly in our ability to vaccinate people. But in general, the antibodies that are induced by the current vaccine seems to work very well against the 117, which is the one that originated in the UK.
I see. So it's entirely possible there's not enough data. We don't know. It's possible we might not even need a booster, considering how successful these vaccines are.
That is considerable. Excuse me, that is feasible. It is quite feasible that we may not. You want to be prepared in case you have to. So we're making the assumption that we're going to have to boost people, but we may not have to.
That sort of brings me to my next question. Is the CDC or NIH, are you guys currently working on changing language now that, in June, we'll be at the 6-month mark for some of the first recipients of the vaccine. And that's when some people are going to get their very first vaccine. So are you already working on rolling out language from get vaccinated to get your booster?
No, the reason is because we don't know the answer to when that booster is. What we are doing is we're going to be stockpiling enough vaccines to be able to give boosters to people. That means purchase vaccines to make sure we have them on hand. We're also doing some clinical trials to see if you boost, what happens to the level of total antibodies, what happens to the level of antibodies against the variant. So we're already anticipating the need to be able to adjust to these variants that might arise. And we're doing the clinical trials as well as purchasing more vaccine in case we do have to boost people.
I see. I just want to briefly touch on the Rangers game on Monday, packed stadium, 40,000 people. I heard what you said about, we don't want to prematurely declare victory, but in the near future, assuming most Americans are vaccinated, I just want to know your personal opinion as a baseball fan yourself. Would you go to, say, a fully packed Nats game knowing that everyone in attendance was fully vaccinated?
Well, if everyone in attendance was vaccinated, I would guarantee you that the level of virus in the community is going to be very low. I mean, they're going to go together. The more people you get vaccinated, the lower the level is going to be because the virus doesn't have any place, doesn't have anybody to affect. That's called herd immunity.
Right.
So I mean, you gave a beautiful hypothetical. I would hope that we would have that situation where everyone agrees to get vaccinated, which I really hope they do, because the more people get vaccinated, the greater proportion of people that get vaccinated, the more easy it will be to get to the point where you could sit at a unlimited capacity Nat game, have a hot dog and a beer and not worry about anything.
But if everybody was vaccinated, you would feel confident at the efficacy of the vaccine to sit there in a fully crowded game of fully vaccinated people?
Yeah, if everybody was vaccinated, yeah.
Okay. Is it
not? It doesn't have to be everybody. I mean,
of course,
if it was 95% of the people, I'd still feel comfortable.
Oh, yeah. Good. Okay. And that being said, there's some polling indicates a concerning percentage of people that don't want to get vaccinated. Do you feel it's possible we won't ever meet the threshold for herd immunity in the US or even globally?
That's possible, but you don't want to make herd immunity an all or none phenomenon here, because it's somewhat of an elusive number and an elusive concept, because it's not only who gets vaccinated, but it's also who was infected and is now protected against reinfection. So, you could wind up getting to where you want to get because the unfortunate people who don't want to get vaccinated could get infected and might be protected because of their infection. I would hope that as many people, including people who've already been infected, also get vaccinated so we can get essentially everybody. You're never going to get everybody to get vaccinated, but as close to that as possible, I think would be optimal.
I see. And are these new variants, are they a risk to vaccinated people?
Variants are a risk to anyone who is not fully protected against it. So, for example, there are some variants like the 117, that vaccines cover them very well. There are other variants like the 351 from South Africa, where protection against any symptomatic disease diminishes by a fair amount, but protection against severe disease, hospitalization, and deaths is very good. So what might happen is that when you get these new variants, some of them may not be protected against when you're talking about mild to moderate disease, but at the same time, people are not going to get severely ill and wind up dying.
I see. And just on a new variant that's kind of emerging, this double mutant variant out of India, there's been some cases reported in California. Are you concerned at all about that?
Like I said, I take every variant seriously, and I like to make sure we match it up against the antibodies that the vaccine induces. If the variant eludes the vaccine, then I get more worried about it.
Okay. And for the people that got the first recipients of the vaccine, since you're not sure about, boosters, there's still not enough data. Some of those frontline healthcare workers that got the vaccine in December, can they be confident that they'll be protected like long after 6 months?
You're asking us in the same question multiple different ways, which is fine, because you want to make sure I give a consistent answer. I'm saying we don't know whether it's going to be longer than 6 months, 8 months, a year. We don't know yet.
Right.
What we have to do is wait until we get to that point and continue to follow the people, measure their level of antibody, and see how long it stays above the protective level. There's a level called a correlate of immunity, that if you go below it, you're not going to be protected. If you stay above it, you're going to be protected. So you follow the level and see how it goes. When it gets dangerously close to that level, you might want to boost somebody. But we don't know whether that's going to be 8 months, 10 months, 12 months. We don't know yet.
Sure. But until then, we're sort of you guys are just stockpiling on vaccines. That's sort of the best strategy right now.
Well, we're ordering enough vaccine to be able to give the boost. Yeah. We want to be able to, if we have to, we want to have it in hand so that we can give a boost.
Will the boost look like just a recycling of the current vaccines, like reusing those?
It could look like the same vaccine, or we are working on testing a boost that's specifically directed against a given mutant or a given variant.
And would people have to be married to the vaccine, the original vaccine they got? If I got the Moderna vaccine, would I have to get the Moderna boost?
It would be optimal to do that.
Okay.
We're doing studies now to see if you could mix and match, if you could match one with another and change. But right now, it's optimal to do it with exactly the same one, since we are not certain of what the results are if you mix them. We're going to do the studies to answer that question.
And one last question, I'll let you go. Do you feel like we're winning the race in vaccinations?
Well, so far we haven't lost it, that's for sure. And I'm hoping that as we get more and more, we have 62 million people fully vaccinated, over 100 million partially vaccinated, and we're vaccinating 3 to 4 million people per day. So every day that goes by is a notch for us. We get closer to winning it. Every day that goes by that you don't see a spike in the number of cases, it's really touch and go, because it's creeping up, but not spiking up. So if we could keep getting more vaccines and more vaccines, hopefully we'll prevent it not only from creeping up, but we'll start to see it go down.
You don't think with the return, like the Rangers game on Monday, you don't think that the return of outdoor events like that, are we looking at a possible new surge coming, or?
Well, if people who go to the games don't wear a mask and are congregated as they were at the Texas Rangers Stadium and don't get vaccinated, yeah, there could obviously be at least a local surge in that area.
But you feel confident at the rate where we're at right now?
I feel good about the rate. I don't want to get mixed semantics. I'm confident that vaccines work if you take them. Put that.
Okay.
And a great last question right there. I'm bringing in now Austin Williams, who was in that interview with Dr. Fauci. Austin, thanks for taking some time out of your day to join us.
Yeah, thank you so much for having me.
Okay, so you asked some really great questions there. First off, how do you decide which questions you want to ask the nation's top infectious disease specialist? I mean, we've been dealing with the pandemic for over a year now, and I'm sure there's a lot of things that you wanted to ask.
Yeah, as everyone knows, he's a very busy man, and we've been chipping away at his team to speak with him for better part of a year. So we had a lot we wanted to ask. We've had various stories we've worked on before that we reached out to him regarding other coronavirus stories. And for this one, we had a team, we brainstormed before, and we figured out what the best questions. We wanted to get as much information as we could in such a short period of time that we had with him.
And so there's a couple questions that I wanted to touch on again. One of those being the difference between the flu pandemic and the coronavirus pandemic. We all know that he had dealt with the flu pandemic in the past. What were your thoughts of his answers on that?
Well, something that has been confusing to me is, when they talk about vaccine efficacy, they say that a vaccine is anywhere from 69% effective against the coronavirus. When I think of 69%, I think of that's a D, but in medical terms, that could be still really good. And so I was surprised to learn that the seasonal flu vaccine ranges anywhere from 40 to 60% effective against the seasonal flu, and it prevents, the CDC report says it prevents nearly 7.5 million cases and 3 million hospitalizations. So I wanted to sort of narrow down, try to get a better understanding of what efficacy meant. But he was very clear, Fauci was very clear, not to sort of get into to sort of compare the two. They're very different viruses, especially COVID, much higher transmissibility and higher death rates. So you can't really compare the two vaccines. The COVID at its worst, according to Fauci, is much worse than the seasonal flu. Yeah.
And you asked a couple kind of fun questions too, threw a couple in there. You asked him if he would go to a Nats game because we all saw the Rangers was totally packed. The stadium was packed for opening day. Every state is looking a little bit different right now. And you said, hey, you're a Nats fan. If it was a stadium completely full, would you go if everyone was vaccinated?
Yeah, we wanted to ask him, what his thoughts on the Rangers game was. That was pretty shocking, the video, nearly 40,000 people in attendance. And of course, if we ask him, what are your thoughts on that game? Would you go to a baseball game now? He'd obviously most likely say no. So, there's a lot of questions surrounding, can vaccinated people gather? What is the confidence level in the vaccines? And so I felt like it was a pretty big deal for him to say that he would attend a Nats game, a packed Nats game, if at least 95% of the people in attendance were vaccinated. I expected him to say 100%, but he said didn't even need to be 100%. He would go if 95% was vaccinated. So I thought that was really interesting.
I think just like anyone else, I mean, we forget that, yeah, he's this guy, he's been put on bobbleheads and has been made a household name, but he's just a person like everyone else who I'm sure wants things to get back to normal so his days aren't as stressful. So I appreciated that personal note there. I'm curious, were there questions that you wish you could have asked him that you weren't able to ask? Your background is in digital reporting. You are reporting on all the top stories of the day from across the country. And I wonder if there's something that maybe you missed and maybe we could be looking forward to in the future to hear from Dr. Fauci.
Well, I definitely like to get some follow-up. The whole angle of the story is on whether or not we're going to need regular vaccine boosters. Is this going to be something like the seasonal flu? So it'll be, and that only takes time for the studies to continue be undergone. And I'd definitely like to follow up and find out more information on that. I mean, yeah, this is Dr. Anthony Fauci. He's the most recognizable person in the country currently. And there's, when you're dealing with something like the coronavirus and a topic like this, I mean, when we were brainstorming what we wanted to ask him and we had such short notice, I mean, it can turn into a 2-hour-long conversation. So just grateful for the time that he gave us. And I mean, there's so much that I want to ask about, just in general, about epidemiology and the virus itself. There's so much to know. It's really overwhelming. So, but it was just really awesome to get to speak with him.
Yeah, and he's really an interesting guy himself, has been under a lot of pressure through all of this, but has been steadfast. And we're looking towards the experts to give us the answers to all of these questions. But great point there. The question of boosters will be something that we continue to follow. And I'm sure you guys will push the Biden administration for answers on that as well.
Yeah, most definitely.
All right, Austin, thank you so much for taking time to break down your conversation with Dr. Fauci. We'll, of course, be speaking to you again. I think this was your first time here on the show, but we take a lot of you guys' content, so we appreciate all of you guys' reporting.
Yeah, thank you so much for having me.
All right, talk again soon, Austin. Thanks. And we are going